Meredith, what about you? Nurse practitioners who may just be getting into the urology space, or maybe even those who have urology experience who may be getting pulled into this new world. What's your advice for them?
Yeah. Right after bladder cancer, APP training in urology is my next love. And there's so many resources available that people just don't know are available. A big one is the AUA, of course. I mean, of all the guidelines, all of that. But much more digestible material is the core curriculum. Yeah. It has great resources. And that's not going to tell you how to logistically do intravesical therapies, but more of the why. I think for APPs, it's really important to understand the pathology, the disease process, the scheduling of each therapy of induction and maintenance and all that. So one thing I encourage is the core curriculum. Also at our institution, tumor boards. I always encourage our new APPs whether they're going to be in oncology or just spending some time with us, to come to tumor board. Such great learning can happen there. I think when I first started, I found tumor board really helped with imaging. I really learned a lot on how to read scans. So taking advantage of what your institution has. We're fortunate that we have a lot of resident teaching conferences and those things. Again, shout out BCAN. I think even though that's really for patients, I think providers can take away a lot from what BCAN has to say. And as far as logistical stuff, I think nurses, APPs, you should be, if you're in urology and doing urologic oncology, you should be so confident with catheters.
Yeah.
New APPs, I try to get their hands on as many Foleys as possible.
Dear 10,000.
Yeah. Yeah, because, we have a lot of difficult Foleys, and on those days, it's me who needs to deal with that and get that catheter in. And so that's a big thing, is be so comfortable with Foley catheters.
Yeah. Same advice we give our residents.
Yeah. Just as many as possible.
And if I may, shout out BackTable a little bit too. For me as a nurse, because I know there is a lot that is geared here towards physicians or advanced practice providers, but to your point, the flow of clinic, you can't always be in the room. Not everybody's open to you shadowing them. To hear the little tips and tricks that you guys have been, even this is how I phrase it to a patient. We don't always get to hear that. We're not in the room. And that is very helpful. And I think it goes both ways. We can all learn the different things, like I said, that sort of click for different patients. You just need to hear it and hear how it's received. And that's been, it's been a really great, for me, peek behind the curtain, time that I don't always get to hear physicians talk about kind of their tips and tricks for patient education. There's plenty for all of us to learn. So this has been an awesome experience just to get to listen to physicians speak to each other about the different way that they make it work.
Yeah. Well, we appreciate that. And that's the mission here. And so I think you're right. I think digesting this information outside of necessarily the written materials that you find on the core curriculum or in a textbook, it's important to hear how things are phrased specifically, how patients receive that, to your point, all really important. I just want to wrap up by saying multidisciplinary collaboration is so, so critical in so much of what we do in urology. We lean on each other, and we're just thrilled to have your voices on the podcast so our physicians can learn from you both. So thank you so much. We appreciate diving into this important topic.
Thank you.
Thank you. This is awesome.